Hey, and welcome back to Girl Talk. We're filming today at America's Best Flowers, a gorgeous space. Can't wait to check in with those folks later in the show. Right now, we're going to talk a little bit about dental care. We got some great tips from Dr. Angela Cody over at Village Smile Care, or I should say, rather, Janet got some great tips.
I did. Dr. Angela Cody is out in Mount Horeb. She's knowledgeable, she's friendly. I'd say if you're going to go for a dentist, she's a good one to go to because she makes you feel so comfortable.
Yeah, you bet. Well, let's find out what she knows right now. Take a look.
If you have anxiety about going to the dentist, I don't think you're alone. But if fear is keeping you from going altogether, you might have some bigger problems. So here to talk us down off the ledge and into the chair is Dr. Angela Cody at Village Smile Care in Mount Horeb. Dr. Angela Cody, thanks for chatting with me today and having me come in here.
You're welcome.
How common do you think is this anxiety folks have about seeing the dentist?
It's very common. Most people do not like being in the chair you're sitting in right now. We see it often, I'd say daily, most patients, a large percentage, and there's studies that show about up to 30% of Americans don't even go to the dentist because of dental anxiety. They avoid it altogether, which is really sad because they're probably having some pain and some issues that could be treated early.
And early is really the key, isn't it? Okay. So what do you suggest? What can someone do? Maybe what can I do or your patients do to help themselves?
Yeah, so people that just have a little bit of anxiety or fear, the best thing is just talk to your dentist. A lot of times it's triggered by a specific incident, so just sharing those stories so they know things to look out for. For example, some patients just really hate the noise of the drill. So there's things we can do to make that more comfortable if we know. We have these great movie glasses here that we have our patients wear, and they have big headphones and you watch a movie inside, and so that's really great for people that don't like the noise or the sounds or don't want to know what's going on.
Just removes you altogether, doesn't it?
Yeah, just pretend you're somewhere else. Other patients are the opposite, where they get really nervous if they don't know what's going on, so they want us to explain each step slowly and check in. Yeah, so it's good to just talk about what your specific fears are. That way we can address it. So for a lot of people that will be very helpful, and a lot of technological advances have made things more comfortable. For some people, they just can't even get in the chair. So there's other options for them, such as nitrous oxide or even oral conscious sedation, so they don't have to worry about that fear.
Tell us more about those.
Yeah, so nitrous is a odorless gas that people know it as laughing gas. So we administer it through a nose piece, and basically we deliver it with oxygen. It relaxes people and just decreases their pain a little and makes them more comfortable in the chair. So that's great for a lot of people. And for those that just can't even handle that, we do offer oral sedation where we use a drug called benzodiazepines. We titrate the dose to the patient, and they are just asleep through the appointment. They don't remember it. Someone brings them and takes them home, and just, they can get all their dental work done without even being aware, which is great for some people.
And those are safe?
Yeah, those are very safe. Nitrous, you can drive home from that. We're able to titrate it very easily and change the dose, so that's great. Very little side effects. And then as far as the oral sedation, we have our patients monitored, so we're watching their blood pressure, their pulse, and their oxygen level in their blood to make sure they're breathing okay. And same thing, we dose it according to their needs. So we're monitoring you the whole time. It's very safe and easy way to get the treatment done without having to have the fear and anxiety.
What about kids? We know it's important to get kids in early. Can those be used on children? Should they be used on children?
Yes, definitely. Especially if the nitrous is very safe. It's often used for kids just to calm them down a little, and we can use very small doses and change it very rapidly. And there are pediatric dentists that are wonderful that do all sorts of sedation options for the nervous child. So there's options for adults and children.
Okay, now let's talk specific. You'll do the needle, the injection to numb the area. What if folks have trouble with that?
So there have been a lot of advances in that as well. The gels that we use prior to numbing are very strong. We order a prescription strength one ourselves, so to take that initial poke away. And a lot of people, what they hate is that burning or stinging sensation that you feel when you get an injection or a shot. And there's actually been things to do away with that. They've been using it in medicine for years, but it's fairly new in dentistry. It's called buffering. So the pH of anesthetic is very acidic, almost like a lemon. And so if we buffer it and add some sodium bicarbonate, it can come down to the pH level of our body. So you don't feel that sting and burn. It also makes it take effect quicker. It's more effective. People get more numb. So a lot of people that had problems with numbing in the past, it's not an issue anymore.
Wow, so many options to help people get in this room and in this chair specifically. Sounds good. Well, you can always talk to Dr. Angela Cody yourself. She's here at Village Smile Care in Mount Horeb. We're Girl Talk. We'll be right back.